Imagine surviving, a combat deployment, navigating a 40-year civilian career, raising a family, and it basically overcoming countless obstacles along the way.
Yeah, that's a lifetime of resilience right there.
Exactly. And then, after all that, you realize that the most dangerous mission of your entire day is simply trying to step over the high edge of your own bathtub without falling.
It's a profound shift in reality. The physical environment stays the exact same, the body ages, but that mindset of fierce independence remains entirely intact.
That is the exact tension we are exploring today. Because experiencing physical or, cognitive changes is challenging enough.
Right, for sure.
Getting the right support for those challenges really shouldn't require a tactical map and a compass. So today we're breaking down a precise, actionable sequence to secure comprehensive in-home care.
And this is such a vital topic.
It really is. Our mission for this deep dive is to map out exactly how eligible veterans can access these vital support services entirely free of charge.
And, this is a necessary mission because navigating the VA system is complex. We are talking about a massive healthcare infrastructure serving millions of individuals.
Yeah, it's huge.
It is. And it can be genuinely difficult to understand exactly what programs you might qualify for. Sometimes you just need some help finding the right resources that are, frankly, already available within the system.
Absolutely. The infrastructure is there.
It absolutely is. It's just a matter of knowing the sequence to unlock it.
Well, the information guiding our roadmap today was provided directly by First Light Home Care of Metro Atlanta.
They really know this process inside and out.
They do. They've shared their expertise, so we're going to walk through the underlying mechanics of how all this works.
Sounds good. So the core focus of our discussion is the VA Homemaker and Home Health Aide program. You'll frequently hear this abbreviated as the HHHA program.
Okay, let's unpack this. What does home care actually look like in practice here? Because that term gets thrown around a lot.
Yeah, it really does.
Like, are we just talking about a volunteer dropping off a hot meal once a day and, doing a quick welfare check?
No, it's far more integrated than that. The Homemaker and Home Health Aide program sends a trained professional aide directly into your home.
Oh, wow. Okay.
Yeah, and they assist with activities of daily living, which are often called ADLs. So we're looking at the critical functions that keep a person safe and functional.
Like what specifically?
Things like getting in and out of the shower securely, dressing, grooming, preparing nutritious meals, managing medication reminders, and, light housekeeping so the environment stays safe.
So it's very hands-on, sustained support.
Completely hands-on. And there is a critical mechanism behind this that ensures the quality of care. The trained aide operating in your home works strictly under the clinical supervision of a registered nurse.
Wait, really? An RN is involved?
Yes. An RN is actively overseeing the care plan. There is constant clinical oversight to adapt to any changing health needs.
That structural oversight is a massive benefit. You aren't just hiring a random contractor.
Exactly. You are plugging into a supervised medical network. Which brings us to the biggest differentiator of the HHHA program. And this catches a lot of people by surprise.
I love a good surprise. What is it?
Well, you might have heard of other VA benefits like the Aid and Attendance program.
Yeah, I definitely heard of that one.
Right, but Aid and Attendance has very strict financial thresholds and specific wartime service requirements to qualify. The Homemaker and Home Health Aide program operates under entirely different rules.
How so?
For HHA, there is absolutely no income limit.
None.
None. There is no asset limit. And there is no wartime service requirement to qualify for this specific benefit.
That is incredible.
It really is. If you're an eligible veteran enrolled in VA healthcare and a doctor determines you have a clinical need for these services, this program is provided at no cost to you, period.
That completely upends the conventional wisdom. So many veterans probably assume they make too much from a pension or, they didn't serve during a designated wartime period.
They never even bother to ask.
Precisely. They disqualify themselves before they even enter the system.
Yeah, it happens all the time. But knowing this benefit exists without those limits is really only the first part of the equation.
Right, because accessing it requires understanding how the VA system actually processes requests. I think the best way to visualize this process is to look at it like a board game.
A board game, I like that.
Yeah, applying is like a board game where everyone starts on a totally different square based on their current VA status.
That is an incredibly accurate metaphor. Your first move depends entirely on where you currently stand.
So let's establish those starting squares. Square one is a veteran who is not enrolled in VA healthcare at all.
Right. Maybe they got their discharge papers decades ago, transitioned to private insurance through a civilian career, and just never interacted with the VA clinical side.
Exactly. If you're on square one, what's the move?
Your very first move is completing VA Form 1010EZ to establish enrollment. You can submit this online, over the phone, or in person, but you will need your discharge papers, your DD-214, to initiate it.
And what is the actual timeline on processing that form? Because I imagine it's not instantaneous.
It is definitely not. It typically takes a few weeks because the VA has to manually pull your archival military service records to officially verify your discharge status.
Oh, wow. Yeah, that's a lot of administrative work.
It is a significant lift, which is why the best time to file Form 1010EZ is right now, today.
Don't wait for a crisis, basically.
Exactly. Do not wait until you have a sudden fall to start building your safety net. Get the wheels turning while you are healthy.
Okay, so that's square one. Square two is the veteran who is officially enrolled in the VA system. They have their ID, but they haven't seen a VA primary care doctor in years.
Gotcha. In that situation, your move is to call and schedule a primary care appointment to reestablish your active status.
Makes sense.
And here's a strategic tip. Ask about the Homemaker and Home Health Aide program on that exact same scheduling call.
Oh, really? Why do it right then?
Because by explicitly stating your interest right when you book, the clinic can prepare the specific intake assessments required for that program. You effectively consolidate two separate administrative steps into one visit.
Which probably saves weeks of waiting for a secondary follow-up appointment.
Exactly.
Brilliant. Okay, square three. This is the veteran who already has an active VA doctor and sees their care team regularly.
If that's you, you are ready for step one of the actual application process. You have the foundation in place.
So let's talk about that process. Step one in our sequence is initiating the request by calling your local VA.
Right?
For example, if you happen to be in the Atlanta area, that number is 404-321-6111. When you get an operator, you need to explicitly ask to be connected to community care.
And you want to approach this call like a logistical operation.
What do you mean by that?
Have your full name, your date of birth, and your VA ID or social security number written down right in front of you before you dial.
Just to speed things up.
Yeah, exactly. Having those identifiers instantly ready allows the operator to bypass a manual search and pull your digital file immediately. It routes you much faster.
Okay, so you've made the call. Step one is done. But a phone operator can't prescribe clinical care.
No, they cannot.
So, step two, how do you actually get this medically authorized?
That leads directly to your primary care doctor. You must explicitly ask the doctor for a medical referral to the Homemaker and Home Health Aide program.
Now, I have to push back here for a second.
Okay, go for it.
Shouldn't a trained doctor already see that you are struggling just by watching you walk into the room? If someone's mobility is declining, why do they have to spell it out for a medical professional?
I get that question a lot. But if we connect this to the bigger picture, we have to look at the underlying environment.
The environment.
Yeah, think about what an exam room actually is. It is a highly engineered, controlled environment optimized for absolute safety.
Oh, I see what you mean.
There is bright, shadowless lighting. The floors are non-slip. There are sturdy handrails bolted to the walls.
The space is literally designed to mask mobility issues.
Exactly. The doctor observes you in an environment built for stability. What they cannot see is that the hallway in your home has a loose rug.
Right, or that the lighting in the bathroom is terrible.
Or that stepping over the edge of your tub requires a precarious balancing act. They do not see you struggling to grip the small cap of a medication bottle at home.
So the doctor only knows the data you provide to them.
Precisely. Which means you must be explicitly honest about your daily struggles at home.
Honesty isn't just venting, it's a tactical tool. You're basically briefing your doctor on the operational hazards of your own home.
That is the perfect way to frame it. For many veterans, there is a deep, understandable reluctance to admit to physical struggles.
Yeah, pride is a powerful thing.
It is. You're dealing with individuals who have endured incredible hardships. Admitting that you're afraid of falling in your own kitchen feels counterintuitive.
But if you downplay your struggles,
Then the doctor documents that you are functioning perfectly, and the system moves on without authorizing care. Complete honesty is the only way to get the right care.
you put the pride aside to secure the resources. Okay, so step two is done. The doctor writes the referral. What's step three?
Step 3, you will meet with a VA social worker or care coordinator.
Why does a social worker step in here? If the doctor already said I need the care, why is there a middleman?
It comes down to how the VA divides responsibilities. The primary care doctor authorizes the clinical need for the service, but the social worker controls the logistics and the budget.
Oh, so they're the gatekeepers to the community resources.
Exactly. They evaluate the practical details of your living situation, determine how many hours of care are appropriate, and process the actual paperwork.
So the doctor writes the prescription, but the social worker actually fills it.
Precisely. And our source, First Light, provided a phenomenal piece of advice for this specific meeting.
What's that?
Bring a family member with you.
I imagine that's because when you live with a slow decline, you adapt to it so gradually that you just stop noticing the workarounds you've built.
That is exactly the mechanism at play. A veteran might genuinely forget to mention that they stopped using the stairs months ago or that they only eat microwave meals now.
Because the stove feels unsafe.
Yeah. A spouse or an adult child acts as an objective secondary observer. They can fill in those critical details that the veteran might forget or downplay.
That makes total sense. Okay, so the social worker has the full picture. Now we move to step 4, which is actually securing the provider.
Right.
And this is where I was genuinely surprised by the information First Light provided. I always assumed that with a massive system like the VA, you just get assigned whoever is available.
A lot of people assume that.
Can you actually just request a specific agency?
You absolutely can. This is one of the most empowering mechanisms of the entire process. You have the absolute right to request a specific VA-credentialed community care provider.
So I could just say, I want First Light.
Yes. If you want First Light Home Care of Metro Atlanta to provide your care, you can request them by name.
But how do you ensure that request actually gets honored by the VA?
You mentioned this preference to both your doctor and your social worker. But more importantly, you bring a short, written letter stating this preference to your appointments.
Having it in writing creates an undeniable paper trail.
Exactly. It forces the preference into your official file. And if you choose First Light, they can actually provide this letter for you.
Wow, so you just hand it over. Easy. So now, step 5. The letter's in the file. And you wait for VA review. The VA decides your weekly hours.
Right.
But administrative reviews take time. What happens if you're waiting for this paperwork to clear and your situation suddenly becomes more urgent? Like, what if you have a fall?
This is crucial. You shouldn't just suffer in silence and wait for a letter in the mail. If your situation escalates, you call your VA social worker immediately.
Because they control the logistics and can flag the file.
Yes, urgent needs can sometimes be expedited, but they can only pull those levers if they know the situation has changed.
You have to be your own advocate. Okay, step 6. Let's assume the approval goes through. The VA authorizes the care. What happens next?
Once approved, the agency sets the schedule. The VA sends the authorization to your chosen provider.
And how long does that take?
It's fast. If you choose First Light, they will call you within 24 hours of receiving the VA authorization to develop a care plan.
And that care plan is under the supervision of their RN.
Exactly right.
Here's where it gets really interesting. I want to talk about what day-to-day care actually looks like once approved.
Let's do it.
Because people often assume government care means rigid schedules. Like, you get exactly 4 hours on Tuesday mornings, take it or leave it.
It's a logical assumption, but it's totally a myth. It is entirely tailored to your individual needs.
What if those needs change? Like, the VA authorizes 8 hours a week, but 6 months later, your arthritis flares up and you need more help.
Then it gets reevaluated. If it's not enough to keep you safe, you simply communicate that to your provider and your VA care team.
So you aren't locked into a strict VA timetable.
Not at all. You and your provider agree on the days and times that fit your life. If your hardest challenge is the morning routine, you schedule the aide for the mornings.
That is fantastic. And do you have to reapply every year?
No. Care is reviewed and renewed about every 6 months automatically as part of your ongoing care.
To keep all this running smoothly, did First Light have any practical advocacy tips?
Yes. Keep a simple log of who you speak with and when. Just a notebook by the phone.
Oh, that's smart. Write down the date, time, who you talked to.
Exactly. It creates a personal paper trail. And one more thing, if you are told you don't qualify for HHHA for some reason, always ask about other options.
Like the VA Aide and Attendance program we mentioned earlier.
Exactly. The strategy is to never stop asking questions.
So what does this all mean? We've covered the starting squares, the medical referral, the social worker, and setting the schedule.
It's a lot to take in, I know.
It is, but I think the most vital takeaway is realizing that getting VA approval isn't just a finish line. It's actually the starting gun for getting the right care in your own home.
It really is the moment the theoretical benefit becomes a practical reality. And, as we wrap up this roadmap, I want to shift the tone for just a second and speak directly to you, the listener.
Please do.
You veterans have earned this benefit through your service to our country. This care is not a handout. It is a benefit you have rightfully secured. First Light Home Care of Metro Atlanta provided this information because they are immensely grateful for your service.
That's a really important distinction.
It is, and it would be their absolute honor to serve you now in this chapter of your life.
If you want to reach out to them to ask specific questions, or if you're ready to name them as your preferred provider, let me give you their contact details.
Care about pen?
The phone number for First Light is 404-333-8282. Again, that's 404-333-8282.
And when you are sitting with your VA social worker, you'll want to provide First Light's National Provider Identifier, or NPI.
Right, what is that number?
That NPI number is 19821-61642.
Handing that number to your social worker just links your file directly to their contract, right?
Exactly. It makes it practically seamless. Hey, as we close out, I want to leave you with a final thought to mull over.
Go ahead.
We often think of healthcare as something that happens in a sterile clinic or a hospital ward.
Yeah, machines, doctors, and coats.
Right, but perhaps the most profound health intervention is simply having another human being help you safely navigate your own living room.
Wow, that's a powerful way to look at it.
What would true independence look like for you or the veteran in your life if the daily hurdles of basic routines were suddenly removed?